Thank you so much, and good morning, everyone. Thank you for joining our Tele-Town Hall. I'm so excited to be sharing lots of great information with you and to have two really wonderful guests to help us get you the answers that you need. Si gusta participar en español, oprime estrella cero en su teléfono ahora. I would love it if we could all be together as we were in the past, all in a great space to see each other, to shake each other's hands, to hug one another, but we're not quite there yet. We can see the light at the end of the tunnel, but we've got to continue to do everything possible for as long as we need to keep everyone safe. And that's why we've converted our town hall meetings into Facebook events, Zoom events, and these tele-town hall meetings. We have so much information to share with you that we don't even have enough time. And so my office will continue to put information out on our website, escobar.house.gov. We will continue to have events and Q&A sessions because the bill that we passed, the American Rescue Act, offers enormous benefits for our community, whether it be enhanced childcare or special support in terms of mental health and healthcare, special support for veterans. We tried to make it a bill that would meet the emergency of the moment so that we can begin to rebuild our country. And of course, you know that we heard the great news in part as a result of the investments that we've been making in vaccines and through this bill that will allow us to continue to make more investments in vaccines. President Biden, after he signed our bill, announced that our communities and our states are going to receive a significant number of vaccinations. So we're very excited about that because obviously the best way to get back to normal is to get as many people vaccinated as possible so that we can be safe. I want to tell you a little bit about our two guests, and then I'm going to give you a breakdown of the two topics that we're going to talk about most. But you'll first hear from Chief Jorge Rodriguez, the director of the El Paso City County Office of Emergency Management. He's going to give us an update on COVID-19 distribution in El Paso. And then after we hear from the chief, we'll hear from Dante Acosta, who is the El Paso District Director for the Small Business Administration. And he's going to talk about federal relief programs available for small businesses in El Paso. After we give you our updates, then we are going to take questions. So if you have a question that either the chief or Mr. Acosta or myself can answer, please hit *3 at any time to be put in line to ask your question. Y otra vez, si gusta participar en español, oprima estrella cero en su teléfono ahora. And again, please visit escobar.house.gov if we don't get to your question, we will write it down and we'll put it up on the web next week. So first, want to talk a little bit about COVID vaccine distribution. We know that the last year we just basically had 1 year. We marked the 1 year anniversary of COVID in our country and COVID in El Paso. And we've lost friends, we've lost businesses, we've seen people really suffer. We've seen an enormous impact on our frontline and essential workers. It has been a really tough year. Right now, El Pasoans who fall in the Phase 1A or Phase 1B categories are eligible to receive the vaccine. Phase 1B recipients include people 65 and older and people 16 years and older with at least one chronic medical condition that puts them at increased risk for severe illness from the COVID-19 virus. In addition to these phases, a federal directive has opened up the vaccination process to teachers, school bus drivers, childcare providers, and other school staff. If you fall in one of these categories, you are able to pre-register to receive the vaccine through the city of El Paso by visiting www.epcovidvaccine.com. Texas is also going to be opening up the vaccine process to individuals who fall in Phase 1C, which includes any adult who's 50 years or older, and that could happen as soon as March 15th. Now, vaccines are also being distributed by other local providers, and so if you want to see if there's a local provider near you you can visit the state website, and we'll have all of this up, by the way, on my website. But you can visit the state website at dshs.texas.gov/coronavirus to find a provider near you. In El Paso, Centro San Vicente is participating in our program to get additional vaccines through our federally qualified health clinics. We're hoping that we can get more of our what are called FQHCs, our federally qualified health clinics, to join the effort in the weeks to come. And we will continue also to push out at the federal level vaccines through pharmacies that are near you. As a reminder, the vaccine is free for all El Pasoans, and the Texas COVID-19 vaccination plan requires providers to administer the vaccine regardless of the vaccine recipient's ability to pay. Now, let me talk a little bit about the American Rescue Plan Act, about the money that we're going to be putting in your pocket. We're hoping to have someone from the IRS on our call, but because there's not guidance issued, they wanted to hold off. But I'm going to give you as much information as I can in the absence of an IRS representative being on the call with us. First and foremost, as you all know, many of you received $600 checks in December. You will be receiving the remaining $1,400 of that $2,000 promise pretty quickly. In fact, we've been notified that some folks have already started seeing the money in their bank account, which is wonderful news for our community. But the federal government is issuing those checks and trying to get that money out the door to all of you. We call them survival checks. So the $1,400 survival checks, to qualify, you'd have to be an individual making up to $75,000 annually, or a head of household filer making up to $112,500 annually, or if you're a married joint filer, you'd be making up to $150,000 annually to qualify. Excuse me. An extension of critical unemployment insurance for millions of Americans, excuse me, will run through September 6th of this year. Excuse me, I'm so sorry. Pardon me. Over $7 billion to get shots into arms, and over $48 billion to funding COVID-19 testing and contact tracing. Over $125 billion for public K through 12 schools to safely reopen for in-person learning. I'm so sorry, excuse me. And continued funding for the Paycheck Protection Program, and expanding who can apply for those grants, including a really exciting program for small restaurants. Many of our small restaurants in El Paso will qualify for that help. Let's see, we also have fact sheets that are available on our website. I want to make sure that you all have access to that. If you have any questions, though, throughout the week, please feel free to reach out to my office, 541-1400. There are innumerable other benefits, like the expanded child tax credit, which economists have told us will cut child poverty by 50%. That will be huge for El Paso. As we look to the future, I am so excited about working with the Biden administration and my colleagues in the House on El Paso's priorities, making sure that we deliver what you need during this difficult time. If you have any questions, once again, please press *3 to be placed in the queue. Y si gusta participar en español, oprima *0 en su teléfono ahora. I would like to now introduce Chief Jorge Rodriguez, who's been, as I've mentioned to all of you before, one of our community's most steadfast, strong, capable, incredible leaders. We are so fortunate to have Chief Rodriguez leading us through event after event after event. And I don't know where he gets his energy. He is a tireless public servant. Chief, thank you so much for joining us today. He is going to share with us information about COVID-19 vaccine distribution in our community, and he'll be here to answer our questions. Chief, I'll hand it off to you.
Thank you, Congresswoman, and good morning, everyone. And Congresswoman Representative Escobar, thank you so much for your kind words. We've been in this fight for several years now together when you're a county judge, and here we are now in this pandemic and everything we've gone through. So I appreciate your kind words. I truly do. So I'll be touching on the vaccination distribution that we have been committed to as a community since December. But when we look at the state dashboard, El Paso County has administered 267,000 vaccines, which equates to 170,000 first doses and 98,560 persons over the age of 16 who are fully vaccinated. So that makes up 15.4% of the population over 16. We're currently leading the state in that metric. So when you compare us to some of the larger jurisdictions, we're several points ahead of Dallas and Austin and Bexar counties and some of the larger communities throughout Texas. So we're doing a tremendous job. Also on our vaccination rate, we've done an amazing job. So when we say that we're doing good on our vaccination rate, that means that how quickly we're able to get vaccines in arms. So between all of the providers, between the hubs, the city's hubs and the county's hubs, we've done a tremendous job. And when you look at just last week, we were able to administer 37,000 vaccines in one single week. So we're doing a great job as a community. From the city's perspective, we continue to work on administering vaccines and identifying improvements in our system. We've had some glitches in the past, and we're not perfect, but we're definitely working every day to continuously improve our scheduling system from our COVID hotline and also our vaccination layouts. We've done a lot of improvement since then. So of the 3 vaccination sites that we have at this point, the hubs include the George Perry location, the convention center, and we're also using our High Ridge Don Haskins Recreation Center as part of our Super Senior campaign. The George Perry location is averaging about 1,500 vaccines per day. The convention center is easily doing 2,000 vaccines per day. So we have a lot more capacity at those sites. And when you combine these locations with the County Coliseum, with the county and UMC, we definitely have a lot more ability to scale and do more vaccines. So right now, it's just the only limiting factor is the amount of vaccines that we're getting. But we are doing a great job of getting those out. As a reminder, we want to let everybody know that that vaccinations through the city's portal, through the epvaccine.com registration list, those appointments are by appointment only. Please show up with an appointment. If not, you'll be turned away. We ask that those that do have an appointment, that they arrive within 15 minutes of their appointment time. Don't show up too early or too late, because then that ends up causing delays for all. We continue to contact those individuals that are due for their second dose via telephone specifically to schedule their appointment. Now, if you are coming up to your 42 days and you have not received a call from us, please contact our COVID hotline at 212-6843 so we can schedule you in. For our first doses, we continue to send out automated messages via text and email to those who have registered. We ask that everybody check their spam and junk folder in their email to make sure that they receive that first dose appointment scheduling link. Any residents that have an issue with registering or booking a vaccine or would like to confirm that they are on the registration list, we ask them to submit a question at our epcovidvaccine.com website. We have a space there where you can send an issue, or you can just contact our COVID hotline at 212-6843. We're also happy to report that our vaccination registration efforts for our most vulnerable populations has been very successful. We have registered over 1,500 individuals through our outreach in the Segundo Barrio, our senior centers, and our station COVID walk-in clinic. We continue to ensure that most vulnerable are accounted for, and we now have registration signups at local grocery stores and businesses. So we're engaging with our business community to set up partnerships so we can expand that reach of our registration list. And then we also have to report that we did receive a small allocation of Johnson & Johnson vaccines this week, and we've already administered those to our homeless population. There's a difficulty in certain populations to be able to access a second dose for them. So by providing this first dose, it really works well for this community. So we're happy to have accomplished that this week. So when you look at our registration list, we are at 268,000 individuals have registered on the list. Like Representative Escobar said, or Congresswoman Escobar stated, we are currently providing vaccines for phase 1 and phase B, and including educators and daycare workers. We're also working on establishing a link for our educators, daycare workers to register on the site. And we continue to filter those who have registered in the later phase to move over to the list, so they now qualify for phase 1A and B. And then also beginning this Monday, persons over the age of 50 will qualify for phase 1C. So that is a new category. We've been in phase 1A and phase 1B for a couple months now. So this is the new addition, a new category, the phase 1C for individuals that are the age of 50 and older. And we'll continue to provide updates as we make updates to the registration system. And in closing, I just want to say that we're exactly 1 year from our activation of our Emergency Operations Center, our emergency declaration at the local level and a state and federal level, and here we are 1 year later. But we do, on behalf of the city and the county, we do want to take a moment to thank the community for following the guidance and orders that we have placed over the past year, and we also want to express our sincere condolences to the families who have lost loved ones due to COVID. And we are having a special event tonight. It's called United with Light, or Unite with Light, by individuals decorating their front porches or front windows with lights to honor those that lost their life during this pandemic. And that will begin tonight at 6 p.m. And just again, gratitude to all the healthcare workers, first responders, emergency management personnel, nonprofit organizations, and other essential workers for their dedication and for, of course, continuing to inspire us to keep pressing forward. So with that, I turn it back to Congresswoman Escobar. Thank you.
Thank you so much, Chief. And I echo your condolences to all of the families who've lost a loved one, friends, people close to them, and just really sending you our thoughts and our prayers and our love. I also agree, our frontline essential and healthcare workers have been remarkable over the last year, and help is on the way for everyone. And the as I mentioned earlier, we finally have hope with this vaccine. We know that Governor Abbott reopened the state and he eliminated the mask mandate. But in order to continue to take care of one another and prevent the spread of new strains of COVID before everyone is vaccinated, we've got to keep wearing our masks. We've got to keep ensuring that we do everything within our power to keep each other safe. Thank you so much, Chief. Our next guest, express my gratitude to him as well. And just as a reminder, if you have a question, hit *3. Para español, por favor, oprime estrella 0 para participar en español. Our next guest is Dante Acosta, the El Paso District Director for the Small Business Administration. And Mr. Acosta is going to talk about the federal relief programs in the American Rescue Plan for small businesses. As I mentioned, there's some really, in addition to PPP, there's some new and exciting support and help for restaurants specifically. But I also want to thank Mr. Acosta, who's just been amazing through all of the new programs that we've put out, trying to help small businesses. He's been there for us time and again. Mr. Acosta, thank you so much. Welcome. I turn it over to you.
Congresswoman Escobar, thank you very much for hosting this and inviting Chief Rodriguez and myself. I appreciate the kind words. Of course, a lot of that needs to go, of course, to my staff here in El Paso. I've got some very dedicated folks that have been with the SBA for many years, and one of them is Jose Campos. He is on the line as well. as my deputy district director, and I might he's going to assist with some of the questions. There's a lot of moving parts, but we want to make sure that we're covering everything that we possibly can. As far as the programs that are available to people, and I just want to stress, as someone who comes with a significant background in small business, I know Congresswoman Escobar is very concerned about our small business community because, like the rest of the nation, small businesses are the lifeblood of any community, and they're the ones that do most of the hiring and provide most of the services at the end of the day. We do have a lot of major employers here, but there's still something special about our small business community, and we want to make sure that we're protecting them and assisting them any way we can. And I know that Congresswoman Escobar shares that sentiment. And, you know, Congress intended this past round, and we're in number 5, or is it 6? I'll stand corrected if it's 6. But Congress intended this last round of COVID-19 economic aid funding to support the hardest hit small businesses and those in underserved segments of our communities, including women, minorities, veterans. And we want to make sure that as the SBA, we're committed to ensuring those programs are launched as quickly as possible to deliver that critical economic aid to America's small businesses and other eligible entities. There are other entities that are eligible for assistance and relief. I'm going to break it down into a couple of things. I'll touch briefly on the new American Rescue Plan. However, we do not have any rules promulgated from headquarters yet. It hasn't gone through all the process in order to get the program up and running, but we will cover that because it is very similar and there's a lot of overlap, of course, with existing programs. It's in my view, mainly an extension of the current programs that we have. We have the loan programs, which are the Paycheck Protection Program, PPP, as everyone knows it by, both here and of course in the media and locally. There are economic injury disaster loans, we call those EIDL, EIDL, and there is debt relief, which is very important for existing SBA 7A 504 micro loan recipients that have those current loans. They will experience debt relief. It was just announced that all of those loans are postponed until 2022 in terms of any payment that is required on that. So that's a big relief to current business owners that hold those loans. There are the grant programs that are coming in and being phased in. We just started the Targeted EIDL Advance, and what that is a direct inquiry to small businesses, a direct invitation for the Targeted Advance for the EIDL loans, the Economic Injury Disaster Loan. There's also the Shuttered Venue Operators Grant, the SVOG, which has not actually started yet. So we're waiting on that for some guidance in terms of when that will actually start. And that's for all of our venue operators. If you think about it, concert halls and our theaters, etc., that are such a vital part of all of our communities, especially here in El Paso. They've been closed for a year, literally today, basically, or this week, and they need relief, and that's what the Shuttered Venues Operating Grant is all about. There are some eligibility expansions on PPP and how the funds can be used. The covered period can be now a choice that the borrower can make, which is between 8 and 24 weeks, depending on what serves their business the best. There are second draw PPP loans for those hardest hit small businesses that need additional relief but already participated in the PPP loan program. One good thing that's happened recently is, of course, the deduction of expenses that are being covered by the PPP loan. Those expenses are still tax deductible. So there's a lot of other little pieces to this that have been updated now. In the new bill will add an extra $15 billion, as I mentioned earlier, for the $15 billion for the Targeted EIDL grant. for those hardest hit and underserved communities. And that's the key. These targeted idle grants are going to communities very much like we see a lot of in Paso that are very hard hit, but they have to be in underserved communities, low-income communities, etc., for that flexible grant relief. So they're going to be very helpful to small businesses, sole proprietors, which include over 90% of minority-owned businesses that have been disproportionately devastated by the pandemic. Restaurants, the bill will provide an additional almost $29 billion direct relief to the restaurant industry, and that's in the Restaurants Act. The restaurant industry has been, of course, one of the hardest hit, and it's probably been the most visible because we go in and we try to, go into one of our mom and pop, panaderias or taquerias or something, and of course we can't sit down or couldn't sit down, so they've lost over $135 billion in sales last year, and the overall industry lost $240 billion. So these are areas that need particular attention, and this bill does address that. The Shuttered Venues Operating Grant, as I mentioned, is a $1.25 billion specifically to those shuttered venues, and the PPP has been expanded in this bill to include additional nonprofits such as the 501(c) labor and agricultural organizations, and some of the local community organizations of a larger nonprofit. So if you think about it, there's a lot of large nonprofits that were deemed too large or too successful. I won't name any names, but you can imagine what I'm thinking of as some of these large names that we're very familiar with. But they have a smaller community center in a community like ours, and they are struggling. So these are areas that are going to be getting additional attention, an initial $7 billion for that purpose. The nonprofits, as you know, they're significant sector in the economy. And, they're really the ones on the front lines oftentimes providing these social services during a crisis such as this. There's also going to be an additional $250 million provided to expand PPP eligibility for digital news services that provide local news services and public health guidance during the pandemic. There's also a community navigator, technical assistance, and administrative funding program with $175 million. And I know that I threw a lot out at you, and of course we're going to open it up for questions, and myself and Mr. Campos can help. But I really want to make sure that folks, if you have questions, that that the best place to get that is on our website, and that is SBA, for Small Business Administration. So it's sba.gov, as in gov, sba.gov/coronavirus. And if you want to look at broader federal assistance information, you can always go to www.usa.gov/coronavirus. So these are areas that are going to be very critical for people to be able to get up-to-date information. So as our information and the rules come out and there's more details, please go to those resources on the internet. And of course, in Spanish, it's www.gobierno.usa.gov/coronavirus. I'm sure that these will all be put on the Facebook page. I don't want to speak for the Congresswoman, but I'm sure someone on her staff will get these on her Facebook page and out on her media. But remember, SBA, www.sba.gov, and you can get all the information on our programs there. And I just want to once again thank you all in the community for being steadfast and in this challenging time. Thank you, Congresswoman Escobar, and I put it back over to you.
Thank you so much, Mr. Acosta. Really appreciate it. And you're right, it's a lot of information, even just on the business side of the plan. So again, I urge El Pasoans to ask their questions. We will put all the information up on our website, and we will continue to have events and informational sessions to educate the community. This is just the first of many. Again, if you have questions, please press *3. Si gusta participar en español, por favor, oprime *0 en su teléfono ahora. And Dirk, I will pass it to you now so that we can begin to take questions from our participants.
Fantastic. Thank you very much, Congresswoman. And our first caller is Maria from El Paso. Maria, welcome to the call. Go ahead with your question, please.
Yes, good morning to everybody. My question is, there is a huge population of elderly and people with disabilities of all ages that do not have the capacity or the means to negotiate computers or can't afford the internet. So how do they access information and get registered for the coronavirus?
That's a great question. Chief? Oh, you're on mute. The phrase of 2020 and
Yes,
now
of
20.
course. Yes. And we still struggle through it, right? So that's a great question. And so for the city's registration, we have established a call center, and it's a hotline. It's 21 COVID, but the phone number where you can contact this hotline, it's available every day of the week. You can contact them for just general information on COVID topics, but also if you want to register and get your appointment scheduled through that phone number, it's 212-6843. Again, 212-6843. Now, we are working on several initiatives. We've been working very closely through the Department of Public Health's COIN program, accessing and working with the ADA community to ensure that we're getting the messaging out to those individuals. We've been working very closely, especially, and I'm glad you brought up the seniors, because that of course is one of our highest risk groups. So we've taken on several initiatives to try to do outreach, where it's not electronic and it's more in person, where we can assist the elderly and the seniors with registering on the system. So we have several initiatives that we've been doing. We've been sending our education task force to several senior centers throughout the community. We've registered over 1,500 individuals through that program. We've also established our COVID Stanton COVID clinic is taking walkthroughs. We've also done engagements at some hard to reach areas like the Segundo Barrio. We've been quite active in that area, going door to door and just engaging with people that may have difficulty or may not have access to the internet or just have difficulty registering online. So we're very tuned in on that. But again, the best way and easiest way to register is to call the COVID hotline at 212-6843.
Question, and I want you to know that in addition to what the Office of Emergency Management is doing, I'm also working with FEMA to try to bring additional vaccines to some of those federally qualified health clinics, and possibly other methods of making sure that we get to some of the hard to reach members of our community, because we all want to make sure that the vaccines go out to everybody. That's what's going to keep us safest. And the OEM has distributed the vaccines really quickly as soon as they get them. It was, incumbent on us to make sure that we got more vaccines and we get more vaccines. That's on the way. So we are going to continue to do better and better and better. Thank you, Maria. Dirk, next question.
Yes, ma'am. Moving on, we've got Tracy from zip code 79904. She's on the line with us now. Tracy, welcome. Go ahead with your question.
Hello. How are you all doing today?
Hi, good morning.
I wanted to know about the, say it again?
Hello?
Hello?
Yes, good morning.
Live. Go ahead with your question.
Okay. Good morning. About the children or teens, where will the young people be able to get the shot?
The question is, where will young people be able to get the shots?
When will young people be able to get the shot?
Chief?
So the way that the CDC and the State Department of Health Services, they provide general phases in which certain populations will fall in. At this point, they provided some general guidance from the CDC side, and teens and children are going to be towards the latter phases of the vaccine distribution. So, but currently, when you look at the Moderna, the Pfizer, and the Johnson and Johnson, if you are 16 years of age and older for the Pfizer, then you are you can take that one particular vaccine. The Moderna and the Johnson and Johnson, you have to be 18 years of age and older. So right now, that's as young as we can get the vaccines out, but we anticipate that coming hopefully by summer, if not sooner, before the new school year. Especially with the news of these additional vaccine allocations that are going to be coming our way. So at this point, we don't have vaccines available for children or teens at this point.
Thank you, Chief. Dirk, we're ready for the next question.
Yes, Congresswoman. Our next question comes from Letitia, zip code 79936. Letitia, welcome to the call. What is your question?
Good morning. I'd first like to say thank you to Congresswoman Escobar and being active and holding these informational sessions. Thank you for all you do for our community, trying to protect the most vulnerable and helping small businesses. It is truly appreciated. I am an educator, and I just want to know, I know recently we qualify now to get the vaccine. We are really still struggling in trying to get the vaccine. I've been going to work since July. When students started, we right away we got them in our classrooms, but I still don't feel 100% protected. What are you doing to help the educators right now? Having access to the vaccine, and also where do we rank as a state or as a city in the state? Where do we rank with educators and the vaccine? Thank you.
Thank you, Leticia. You are, and first, thank you for your very kind words at the top of the call. You are sharing with us what we have heard from innumerable educators. The federal government gives the vaccines to the state, and it's the governor who determines which groups get the vaccine under who's going to be 1A, who's going to be 1B, et cetera. Some states we saw included teachers and childcare workers in those groups. Our state did not. But Chief Rodriguez, I understand that educators are now, after the federal mandate, that educators are now in the queue. Can you tell us about those efforts? I know some districts are working to expedite that. Is that true for all districts? What can you share with Leticia and with all educators on the call?
Right, and so when the state established this new not necessarily a new category, but just by issuing this directive, they allowed educators, daycare workers, other school faculty to be able to become essentially part of the phase 1B. So we are and have been working with the school districts very closely. We've already prior to this directive, we've done over 2,700 educators and staff throughout the schools. And as we continue to expand our additional providers and additional allocations, we've seen partnerships with some of the smaller partners with the school districts. So that's one point of entry for educators. But as we increase allocations, hopefully that our ability to reach more educators is going to improve. But as far as the registration, we just continue to ask all educators. Like I mentioned at the top of the call, we are adding a link on the registration area so they can identify themselves as educators. But with the phase 1B as it is, if you're already an educator and you have a health condition, any health condition, and you're over the age of 16, you'll automatically qualify for the vaccine. So if you've already registered, great. That's already putting you in queue. But if you're, for an example, a younger teacher that doesn't have a health condition, now with this new directive, you are eligible for the vaccine. So go ahead and register and get your name in queue. And as those allocations continue to increase, we'll definitely we'll be expanding that reach into our educators and daycare workers and other staff.
Thank you, Chief. Thank you, Leticia.
All right, next we've got Jerry joining us from zip code 79904. Jerry, welcome to the call. You're live with Congresswoman Escobar.
Good morning.
Hello, Jerry.
Yes, I'm here. Good morning.
Yes, sir. Go ahead with your question.
Yes, this is Gary Gonzalez, Big G. I'm calling because on the stimulus check, I'm disabled, permanently disabled, so is my wife, and we don't do no taxes on our income. We received the 2,400, but the 600 we didn't receive. So I called the IRS. They said that they had a glitch in the computer, and that they'll be mailing out those checks soon. That was almost 6 months ago. So they told me now that I have to file taxes and put it on line 30 to recoup those $600 or $1,200 that we were supposed to get. To this day, I still have not received the $1,200, the second stimulus that they approved. I'm still waiting on that. Can you answer my question? What's going on with the IRS? To this day, I still have not received it. So I appreciate it. Thank you very much.
Yeah, of course. Good morning, Gary. Did you say that you received the December check, or you still have not received the December check either? Or is that you all did not get?
The 2,400, the first check, I owe child support, so the child support took it. But my ex-wife passed away towards COVID because she had a kidney and liver transplant, and she caught a pulmonary, and her organs shut down, and she passed away in March of last year. And our child support was telling me, well, we're going to keep it and send it to the adult child. I said, well, is it the law? Because my understanding with the law is that it's supposed to be returned to me, the $2,400. And she says, no, it's our procedure. I said, well, your procedure does not overstate my right to have that money returned to me. If she passed away, that means the debt is canceled. If my adult son wants to continue with the debt, he has to take me to court and request that money. But until then, that money needs to be returned. So
Gary, Gary, can I interrupt you for 1 sec, Gary? Because your case is going to be more complicated. We probably need to open up a case for you. So I'm not sure if we have your phone number. If your phone number was taken down, then we will call you on Monday. If you don't get a call from us on Monday, we got it? Okay, we've got your number, Gary. So we're going to call you on Monday. Your case sounds so complicated that we've got to do some casework for you. And we're going to have to inquire on your behalf. You'll have to fill out a privacy release form so we can do it, but we want to help you. But for
I did that with the state representatives. They got me my check back from child support, the 2,400. We received that.
Okay.
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 But the 1,200 one, I talked to the IRS, and they said, well, we'll send it out to you as soon as we can, I guess. And I'm still waiting on that.
Okay. So here's what I can tell you, because we've gotten lots of questions and calls in the past about that $600 check in December. There are still a number of people, a number of constituents in El Paso and actually all over the country who have not yet received that December check, but they do qualify. They meet the qualifications. So here's what we have been told by the IRS. When you file your 2020 taxes, there will be an option for you in your taxes to apply for the recovery rebate credit. And you will ask for the full $2,000 per person, per eligible person in your household on your taxes. And that's how you're going to get it. I apologize that you all did not get it in December. We did see the IRS under the prior administration not fully amp up staffing, and that has hindered a lot of that, but I know that the Biden administration is wanting to ramp up, all arms of government to make sure that we're highly functioning. But until then, please request the recovery rebate credit on your 2020 taxes. And then call us and let us know if you continue to have problems, Gary. Thank you so much.
Thank you very much, Congresswoman. Moving on, we've got a couple of online questions. The first one was submitted by Elisa, who says, my dad is 93 and took his vaccine 2 weeks ago. Can he take his second vaccine at another location?
Chief? And you're on mute, Chief.
You on mute?
There we are. So I'm assuming that they received it at the city. So we do have other locations. Currently, we are doing our first dose administrations at the convention center, and the second doses we are doing at George Perry. So unless they're notified otherwise in the next several weeks that they have an option to go to the convention center, at this point we are doing all second doses over at the George Perry location. If he did get it at the super senior location on Don Haskins, he can also receive his second dose at that location. So, but if you have any issues, again, contact the COVID hotline 212-6843 if there's any issues on him getting his second dose.
Chief.
All right, our next online question was submitted by David, who says, we were eligible for the first check, but never received it. Now I'm concerned may miss this one. Who do we contact?
So the best, so we've been referring some folks to the IRS website just to check, to input their information and check to see if they've gotten any information through the IRS website. But checks, the current checks are pretty much en route now. And so if you have direct deposit, you will see that money in your bank account pretty quickly. If you don't have direct deposit and you're waiting on a check, that takes longer, of course. But if you have direct deposit, you didn't get your first check and you're not quickly getting this check, when you file your 2020 taxes, as I mentioned to Gary, be sure to file to request through the recovery rebate credit the amount of money that is outstanding. So if you didn't get the $600 in December and you've got the $1,400 that you did not receive through direct deposit, here in March, that's a $2,000 credit that you need to request through your taxes. And unless you owe taxes, you'll be getting that money once you file. But if you continue to have problems, again, please call us at 541-1400. Thanks. Dirk?
All right. Yes, ma'am. We've got another question. This one's submitted by Rosa in zip code 79928. And the question is, why can't clinics give another person a vaccine if someone decided not to use theirs?
I don't know, Rosa, I don't know the protocols for the clinics. Chief, are there certain protocols about that? Or what are the protocols for you all? If somebody doesn't show up for their vaccine, for example, either at the George Perry site or at the senior super center, what do you do with those extra vaccines? Can people just show up? What do you recommend?
Well, and that's in large part, and that's a great question. So in large part, it is largely about quality control and taking the measures that. So for every appointment that is set up, be it through the city locations or some of the private clinics, that particular vaccine is assigned to that one individual. So once we start that documentation and that individual gets his first, so let's say it's a second dose that's extra or whatever the case is, we have to specify that to the individual. We take close measures, or our quality control to ensure that there's no waste of vaccines is essential. So we try to match that up as much as possible. But once you're in the system and you received a dose, then there's a specific lot number that is then assigned to that individual. And once you are queued in for that second dose, then we have to account for that second dose for that one particular person in 3 weeks from when they're due. So it in large part is the documentation and ensuring that we're allocating the vaccines for the people that we have signed up for that one particular day.
Thank you so much, Chief, and thank you for that question. Dirk, ready for the next one.
All right, Congresswoman. This question was submitted by April, who states, I'm requesting for public acknowledgement of those who have lost a loved one due to suicide during this global pandemic. Is there a way for your office or the city to provide better public announcements, followed by providing resources?
That's a great suggestion, and that is absolutely true. The pandemic has really exacerbated existing mental health illness issues that folks are facing, and others I've heard it has triggered new mental health challenges. There's been tremendous loneliness, feelings of isolation. We had a specific town hall meeting for mental health to try to connect El Pasoans with services that are available. We've got some really incredible mental health providers in our community, and many of them will provide mental health treatment regardless of a person's ability to pay or on a sliding scale. And because of that, many of us in Congress worked really hard to make sure that the American Rescue Plan has funding for mental health providers who have been on the front lines trying to help people cope through these really challenging, lonely, isolating times. In fact, we approved, or we voted on, I think, almost $4 billion. So we're going to be getting that money out into the community. But you make a great point. We have to do a better job of getting that information to people. Thank you for raising that issue. And Chief Rodriguez, if you all on the Office of Emergency Management and City side can do that, we will continue to do it as well. We have some resources on our webpage. But we will continue to push out that information because you're absolutely right. Thank you. Chief, anything you wanted to add?
Well, we have worked very closely with our local authority, Emergence. They did have, and they do have a crisis line. I don't have it in front of me, but if we can post that later. But they do have access to mental health support specific to the COVID pandemic. So I think that's one local resource that we can access, and one that we've been working closely with.
Those other resources on our webpage as well. It's not just the feelings of loneliness and isolation, but it's people feeling desperate because they've lost jobs, they've lost homes, they've lost cars, they've lost loved ones. And so we will do everything possible to get that information out into the community. Thank you.
Thank you, Representative. Moving on, we're going back to the phones. We've got Mike from El Paso joining us now. Mike, welcome to the call. What is your question?
Good morning, and Veronica Escobar, thank you very much for everything you do. This is the two-part question for small business. My first question is, if you registered last year in the first go-around of these relief funds for small business, do you have to re-register? And the second question is, if you're a owner-operated business with no employees, are there any funds to help you pay off debt and help you with debt relief? Thank you.
So, Mr. Acosta, are you still on the line? And were you able to, and Mike, thank you for your question, and thanks for participating. Mr. Acosta, did you hear the questions so that you can address Mike?
Yes, I did hear the question, and I was going to have Jose jump in and take that. Go ahead, Jose.
Okay. Good morning. Can you hear me?
Yes, sir. We can hear you.
Okay. Thank you. First of all, they don't have to be registered to apply for the PPP. If they already utilize the funding last year for this first draw for the PPP, they can apply with their lenders for the second round of PPPs. Now, if you don't have employees, there's a new program that utilizes a new form that is the Schedule C, and which allows sole proprietors with no employees to get either first or second round of PPP through the Schedule C. So they can apply. Now, if they need funding for working capital or to pay the expenses, they can get the loan, the economic injury disaster loan, which is the EIDL. Now, the only thing is they already applied for an EIDL loan. They can only apply once. They cannot apply the second time around. I hope that answered the question for the gentleman.
Mike, are you still on? Did that answer your question?
Congresswoman, I apologize. I have readied the next caller, so I
Okay.
did have to disconnect Mike. But we certainly answered the questions that were asked by the call.
Great. Thank you.
Moving on, we've got Marcy joining us now from El Paso. Marcy, you're live. Go ahead with your question, please.
Yes, good morning. The topic is the COVID. Well, my question is, I was questioning the fact that due to the governor's decision of opening the businesses 100% and no mask mandate, even though here in El Paso the businesses are open probably 100% because everywhere, but the mandate of wear masking is still, enforced. I don't think that is right, due to the fact that we all know about all the illegals that are entering into the United States that have been positive for COVID and are not even vaccinated or tested or anything else. What exactly, Mrs. Congresswoman Veronica Escobar, are you going to be doing in regards to that? And how exactly is this enforcement to wear a mask? Because if you don't wear a mask, according to them, you cannot get their service.
Thank you for your question, Marcy. So first, about the mask mandate, you are right. The mask mandate has been lifted and the governor has reopened Texas. That despite the fact that we had seen a 26% increase in our state in COVID positivity rates. And so, many folks, myself included, believe that the lifting of the mask mandate and the signal that the mission has been accomplished was the wrong thing to do by the governor. And it's why I am encouraging folks to please continue to wear their masks. Please continue to do everything possible to keep one another safe. We are not out of the woods, even though the light is at the end of the tunnel. And I feel hopeful. I know a lot of folks feel hopeful. We're not completely safe yet. There are various strains that we are seeing, not just globally, but here in our country as well. Strains that could complicate herd immunity and our ability to achieve herd immunity. Private businesses, they have every right to require people to wear masks. I grew up with signs, I remember in the 70s, that said, no shoes, no shirt, no service. The same thing goes today. And many businesses are choosing to say also, no mask, no service. And they have absolutely every right to keep not just their customers safe, but their employees, many of whom probably have not received the vaccine and who need to be protected as they serve our community and as they offer us services and care, and they are there as essential and frontline workers. So let's all do everything possible to keep each other safe. Let's make sure everybody gets the vaccine. That's part of why this package is so important, because it will help us fuel vaccine distribution to the states so that the states can then distribute them to folks like Chief Rodriguez, and he can get them into the arms of everybody. But we've got to make sure that we take care of one another. Now, to the question of the migrants, so we know that many of the same restrictions from the prior administration are still in place, and I won't go into excessive detail because I want to focus on the American Recovery and Rescue Plan. But I do want to answer the question about the COVID situation. So we are seeing unaccompanied minors arriving in our community, and they will get tested and quarantined before they go, when they go get into HHS, Health and Human Services custody. So they are not going out into the community. They are, before they go into a shelter, they will get tested and quarantined. So that's happening with unaccompanied minors. We are also seeing some families who are arriving on flights from the Rio Grande Valley. These are families that are not being accepted by Mexico under what's called Title 42. And so the El Paso Border Patrol sector, much like it did in 2014, is helping the Rio Grande Valley process those families. And so they are coming into a central processing center. I toured it yesterday. I visited with the Border Patrol sector chief, members of her team. I toured the facility. I spoke to some of the migrants. We need to make sure that we test and every single individual coming into American custody, and that we quarantine anyone who tests positive, so that we do two things. Number one, that we process people humanely, but number two, that we keep the community safe. Unfortunately, Governor Greg Abbott has decided to stand in the way of funding from FEMA that would help us do the testing and quarantining. FEMA, under the Biden administration, has said, communities, we want to reimburse you 100% for that testing and quarantining. We don't think it should be your burden. It should be the federal government's burden. But we need the governor to accept the help. Governor Greg Abbott has rejected that help. Now, again, thankfully, our Office of Emergency Management and our NGOs here in El Paso, as per usual, have stepped up to the challenge that we face, and they are ensuring that we are testing and quarantining every migrant in order to, again, process people with humanity, and number two, make sure that we keep the community safe. Hopefully, Governor Abbott will allow us to access that badly needed funding that the federal government would like the community to have. I sent Governor Abbott a letter that was signed by my Texas Democratic delegation, and we are going to keep putting the pressure on him to allow us to access those funds. Thanks so much for the question. Dirk, next question.
Yes, next we're joined by William from zip code 79912. William, welcome to the call. You're live with Congresswoman Escobar. What's your question?
Yes. Well, I had a few questions about it. It seemed like you've already answered one about the mask mandate, and that's going to continually go on, or you're saying that people should continually go on. My question was in regards to financial aid for everybody. I understand that you guys were more focused on the areas that were more heavily affected by COVID, and like the individuals affected by that. But my family has been unable to receive any sort of financial aid from the government or from the Small Business Association and stuff like that. I was just wondering if you guys were planning on either increasing the range for and allowing certain individuals to receive this federal aid, or if you guys were planning on transitioning since most of the areas that have been affected have been covered and stuff like that, so that everybody, instead of just most of the people, have some form of financial aid during these hard times.
Thank you for your question, William. So the many of us fought for higher thresholds, myself included, on the money in the pockets, on the stimulus checks. But unfortunately, the Senate negotiated many of those thresholds down. And so the threshold remains at $75,000 per individual for the checks, $150,000 for those families who are joint filers. And again, this includes the dependents. And so unfortunately, like if those with parents, those dependents with parents who don't meet the threshold or who exceed the income threshold, those dependents don't qualify. So it's only those who qualify under the thresholds. But I agree with you. I personally advocated for making the thresholds broader so that we impact a larger group of Americans. To the business loans, that also was negotiated down by the Senate, and I advocated for no upper limit, so that every business, if it wanted to, depending on revenue, depending on losses, et cetera, could potentially qualify. But I do think it's important that, especially on the small business side, because on the IRS, the stimulus checks, that's pretty straightforward in terms of who qualifies. Also, same thing for the child tax credit, although that has been expanded. We were able to get a broader group of Americans to qualify for the child tax credit. But I'm going to turn to our SBA partners, or actually even Ben Harrison from my DC office. Were there any changes, either one of you, if you can answer, were there any changes once the Senate made its changes to our bill? Were there any changes made to the parameters for PPP, for example, outside of just extending the deadline?
This is
Do you want? Go ahead, Jose.
Yeah. I know this new round of funding from the American Rescue Plan Act. They're increasing, as Mr. Acosta mentioned, they're increasing the amount of money in the pool for the PPP by $7.25 billion, and also for the economic interest disaster loan by $15 billion. That's just the funding, but the rules are set already with the regulations from the SBA. I don't foresee any changes on those rules except the deadline for expiration on the PPP, which is March 31st. Maybe the fact that there's more funding, probably they may open up a new window that it covers and taps this new funding for these small businesses to continue applying. That would be the main changes, but not the parameters and the rules. I know on the White House recently adjusted the funding and the requirements from the bill signed in December 27th that allowed small businesses with 20 employees or less to, especially the very small businesses, sole proprietors, that they applied for the Schedule C. Instead of using their total salary for those employees, is actually their profit, the net profit that they show at the end of the year. And the administration said to instead of using the net profit, use the gross profit there, the revenues minus their cost of goods sold, without considering the operating expenses. So that allows, with the computation, for them to receive a little bit more money. That was a new change with President Biden's on the previous bill. More likely, it'll continue the same way, but we need to see what the new rules will come out from headquarters, and we don't know then that until we receive the information probably next week.
Right, and thank you, Jose. This is Dante Acosta, the SBA. A couple of things that I want to just touch on briefly. The targeted idle grants that are out there, that's the additional $15 billion that Jose just mentioned, is new funding, and that's for underserved small businesses. I don't know the specifics, and we can't get into it on this call, obviously, of this particular small business or why they may have been denied or it went into a black hole or what the situation was. So I'd encourage you to contact our office because there are expanded eligibility in some of these, the newer legislations. Again, as Jose mentioned, we don't have our rules promulgated from this latest bill, the American Rescue Plan, so we have to be a little more general based on what the plan, what's put out there. And of course, the Congresswoman's office has released. So depending on your particular situation, sir, I would really suggest that you look at the new technical things that are in the bill, talk to our office, and I really encourage people to go on every single day. We are doing, our staff is doing both in English Monday, Tuesday, Thursday, Friday, and in Spanish on Wednesday. They're doing a webinar on the issues surrounding the previous bill, and of course we'll fold in the new American Rescue Plan. So rather than try to give you a big long web address to confuse everybody, simply go to your computer and Google El Paso SBA District Office, and what shows up for me consistently is right below the map. So go to El Paso SBA District Office. Right below the map, you'll see El Paso District Office, the U.S. Small Business Administration. And as long as it starts with SBA.gov, and it says offices and then district, so that's why it's long. Click on that, and you'll get directly to our office webpage, and you can sign up for our webinars there. And what I'd like to say too is if you have an issue, please call our office at 915-834-4600, and we can assist you here locally with an issue like that. But I want to make sure that everybody's getting the information current, so that's why we're giving out these web pages, the SBA.gov, and of course encouraging you to go to our local web page for the webinars that both Jose are doing and Leanne Vega from our office are doing, and we just want to make sure that you're all covered. But thank you for the question.
Thank you so much. Really appreciate that response. And we are going to. I just want to share with everyone, as these rules are crafted by the administration, we are going to continue to deliver information to the community. So, it's a really big bill. We've tried to make adjustments and changes in order to help as many people as we possibly can. And I think we're actually going to be doing a small business town hall soon. So please stay tuned so that we can continue to try to get you answers to your questions. Now, we are an hour and almost 20 minutes into our town hall meeting. I think we have time for one more quick question before we close.
All right, Congresswoman. Rita from El Paso joins us now. Rita, welcome to the call. What is your question?
Thank you. I'm sorry to hear a lot of noise in the background. I have a plumber here. My question was, I work for a big school district, the El Paso Independent School District, but I don't meet with the employees, but we meet in the hallways and we talk about the different types of vaccinations that everybody's getting. And what I'm hearing as a consensus, they're saying that there's one shot, one vaccination that they prefer to get as opposed to the others, and it's because of what's been indicated on the media about the vaccination. When we go get the vaccination, do they indicate this is what you're receiving today? And do they give you the option of saying, I don't want that one, I would like this one, and do they go ahead and turn around and give you the one that you want? Or is it you're just going to have to be getting the one that they're administering? And if we don't want it, we deny it.
I want to just first, before I turn it over to the chief, I want everyone to know that if you have the opportunity to get any one of the vaccines, do it. Do it. We need you to get vaccinated. They're safe. They are going to be key to all of us getting things back to normal, getting our economy back on track, being able to be with our families once again, see businesses reopen, and see life begin anew for all of us who have been locked up for about a year. But Chief, great question about, do you have a choice in which vaccine you get? What if you reject it? Does that mean if the others are not available, you just don't get it? How safe are the 3 different vaccines?
Well, in terms of of, you know, whether or not you don't have a choice to get it's largely dependent on the allocations that we receive and what each individual provider receives. So as an example, with the city, we have primarily dominantly have received just Moderna, whereas the UMC hub has received Pfizer and Moderna, and then this last week we received Johnson and Johnson. So, and each of them, like we stated earlier, the Johnson and Johnson, we're trying to use those for some of our most vulnerable populations, those that are difficult to access, where it's going to be difficult to follow up with a second vaccine, like our homeless population. So, in respect, it's largely dependent. Right now, I don't think we have that option just because the allocations are so small. So as we continue to get more vaccines, I think that option might become available to you. But at this point, it's largely dependent on what we receive. And as far as that, as far as the safety, like Congresswoman Escobar stated, whichever one that is being provided they all have a life-saving potential. So that's the goal, is to not get hospitalized, not to end up getting very sick. And the 3 vaccines that are currently available will do that. So we'll see. We'll see what the future holds as we receive more allocations, and if those options become more available, and you can pick and choose which ones are going to be best for you.
Thank you so much, Chief. And again, I would urge everyone, if you have the incredible good fortune of being one of the ones who has the option to get your vaccine now, please do it. We are coming to the end of our town hall meeting, and before I kick it over to Dirk to close us out, I want to thank our guests, not just for their time this morning, which was invaluable. Thank you so much for answering all these questions and the questions that are in the queue. But thank you for your leadership. Thank you for what you do for our community, especially during some of the most difficult times. So thank you, Chief Jorge Rodriguez, Dante Acosta, Jose Campos. I also want to thank my staff and my team for putting these great events together, and for the team working behind the scenes to bring you this information. I hope it has been helpful, and I hope it's answered your questions fully. I want to also thank my translators who are making sure that our Tele-Town hall remains bilingual, our ASL interpreters who work so hard to make sure that everyone gets the information that we need. And then, of course, I want to thank you, El Paso, for the opportunity to serve as your Congresswoman in Washington, D.C., the opportunity to work for you, and for your participation today. We are going to continue to get this information out, especially as new information and new rules are applied to the legislation that we passed. This is not the end of it. Please also check back on our website, because if you wanted to have a question answered related to our topic and we didn't get to you, we will put the answer up on our website next week. And with that, Dirk, I'll pass it back to you. Everyone have a wonderful day.
Thank you.
Thank you very much, Congresswoman. And as mentioned, we are coming to the end of our telephone town hall meeting this morning. Thank you for taking the time to join us for this important conversation with Congresswoman Veronica Escobar. We appreciate the opportunity to speak directly with you as well as answer your questions. If we were not able to get to your question this morning, you can send us an email at veronica.escobar@mail.house.gov, or you can call our office at 915-541-1400. We will host more of these events in the future to keep you informed on what we're working on in Washington, D.C., resources in our district, and other important updates regarding the coronavirus and our economic recovery. Thank you again for joining us, and have a good weekend.